Everyone, it is Heather with Holistic Healthcare and Midwives. As promised, I'm going to give you a little introduction as to what a midwife actually is. We all know what a doctor is. A doctor is someone that has gone through years of medical school to specialize either as a family doctor, and in this case, a gynecologist or a obstetrician. Let's get back to what a midwife really is and what her responsibilities are in a home birth situation and setting, and how the care of being with a midwife will be very different than what you've ever experienced when you've gone to a obstetrician. I have been a blessed midwife since 1980, and I am 57 years old, so that is 37 years of midwife experience. Okay, let's start from the beginning. You are pregnant. There are so many emotions that go along with that, whether it's a planned pregnancy or it's a surprise pregnancy. And suddenly you realize, oh my goodness, I'm going to have a baby. Most of the Americans today have insurance, and therefore that leads them into a hospital system. Now, as a nurse since 1987, I have had the privilege, I suppose, of working in the units of labor and delivery in many, many hospitals. And the current healthcare model does not give any credence to the fact that having a baby is a natural thing that our bodies are made to do. Instead, they make it what they call a pathological problem. Pathology means that pregnancy is an illness. Pathology equals illness. Okay, so you decide that you want to do it natural, which most women want to do. Having a baby at home will include needing a very experienced midwife. Now, there is a number of types of midwives. There are what they call at the moment the CPM midwife. This midwife is usually younger, in her 20s or 30s. Hopefully, she's had a baby at home herself. And she has gone through classes and she has got a certificate to practice midwifery. Therefore, she is a certified practicing midwife. You also have something else that's new in the field, which is a doula. I happen to have a doula certificate. Now, what a doula does is she's not a midwife, but she is a lay person that has been through classes, and she is prepared to meet with the mother at her home and the father and whoever is going to be involved and see the lady about 4 times before she actually gives birth, teaching her how to write up a birthing plan to give to her physician, who also comes over to her home when she's in labor and goes with her to the hospital and stays and gives multiple comfort measures and helps the father give comfort measures, as well as advocate for the mother and the father and baby with the doctors for the birth plan to be supported. She will also possibly be a postpartum doula who will come home afterwards and assist with housekeeping chores, helping with rest, as well as some breastfeeding tips. However, a doula is not really experienced in a very wide range of things, but she is better than going to the hospital alone. Here we go with the midwife. I am a lay midwife. I am a midwife that at 20, I had already had 2 home births. I had begun intensive research and studying on my own. I began working at clinics and with other midwives, and I was taught through clinics and midwives how to be a midwife. That is a lay midwife or a granny midwife. And after I did that for about 7 years, I chose to go into nursing to find out why. I had many women asking me why, and I didn't feel like it was fair to them to give them some sort of answer called, I don't know, I'll get back with you, because we're dealing with a life here, right? I chose to go into nursing so that I could be a more well rounded midwife. I also always had a kind of, I would say, philosophy as a lay midwife before I went into nursing, and that was called that I was not into this for an ego trip. I was not into this for a paycheck. As a matter of fact, I consider myself and still do a spiritual midwife because giving birth and becoming a family member and a mother, father, and having a baby is probably one of the most incredibly spiritual acts you will ever do. So, with that being said, I might always say better safe than sorry. For a home birth to occur, I would prefer to meet my client as soon as possible, which is what leads me to doing this series. A pre parenting class will help to prepare your body to carry this baby in the 21st century. Now, when you choose to get a midwife, I would suggest that you interview 3 midwives. CPM midwives are going to be young, a little less experienced. They are licensed, so they are able to use your insurance. However, that does not necessarily mean that they are going to have experience. A lay midwife, such as myself, who has over 37 years of experience plus the nursing, I will not be able to take your insurance. However, since I take this on as a spiritual gift, I will work with you in a sliding scale manner, and payment is not what I'm after. What I am after is for you and for your family to have a fantastic pregnancy and a fantastic birthing experience, as well as after the birth is over, a 100% support. So, ask your midwife when you meet her specific questions concerning one, how many years of experience has she had? How many birthings has she actually been a part of? How many babies has she actually delivered? Where did she receive her certification if she's a CPM? Or if she's a lay midwife like me, I will have references, I will have resumes, I will have places you may call. Also, another thing to consider too is how you and your husband, or your husband and yourself, or whomever is going to be with you for this birthing, how do you feel about this woman? One of the first criteria, I believe, honestly, in being a midwife is that I can't help someone have a baby unless I have had done it myself. I have seen many nurses that have never had babies before in labor and delivery be helping moms be actually thrown out of the room by mom when she gets into active labor because she realizes she has no one that's ever had a baby before. And I feel like that's a prerequisite. Whether you've had a baby in the hospital or whether you've had a baby at home, already having one makes you a whole lot more believable when you really need to know, when you're really thinking you can't go through this labor alone anymore, that you can. And I'm here to tell you, you can. Now, the difference between a midwife and a doctor is this: when you meet with me, we will hopefully have met early on in your pregnancy, hopefully within the first 6 weeks or before with the pre parenting class. You will be followed by me every month, and that will be for 9 months. You will be seen every month, and we will discuss things about nutrition, how the baby is growing, everything to expect through this particular month, all the tests that will be needed to be run, whether or not you want to have an ultrasound or not. For I do not do ultrasounds unless I feel there is a serious problem or a potential problem. But a lot of ladies like to know the sex of the baby, and they'll have an ultrasound done around 4 months along. And that's kind of a trendy thing to do, to see the sex of the baby, and I understand that. However, as a midwife, that's not something I really need to know. However, you're not going to just be brought out into a field. No. You will actually have the proper blood testing. You will see a doctor, whether it be through a clinic or a doctor that you choose to see through your insurance. And we will get everything started for a baseline of where your body's at. Now, a big difference. Every month when you go to a doctor to see him, you usually are going to have about a 10-minute time. And the unfortunate thing about the medical community and the gynecologist and the obstetrician is that if you happen to really love your obstetrician that's going to deliver your baby, 9 times out of 10, that doctor will not be there for you. No, no. And so it's very hard to bond. And you also have about a 10-minute visit, usually with a nurse practitioner who works with the physician. Whereas a midwife, you can bring your kids and we will talk about every question, every situation coming up in your life at that time. You will also be taught nutrition, vitamins, all types of things that we need to do to make sure that we're starting off in a very good fashion, because that's what we're doing. We're trying to keep this birth a low risk birth. That is what a home birth client will be. Someone that hasn't got any developments of high risks, and we'll go into that later. But what a midwife will do is actually give her time to you. I will give you more than 10 minutes. I will give you the time that you need. And we'll talk about a lot of things. Another thing to expect is that you can actually call her up, your midwife, a good one, anytime you have a question. Now, you may run into situations where midwives have a team, but it doesn't mean you're not going to have the midwife that you want to deliver your baby. You will have that midwife unless for some reason she's ill or some sort of thing has happened where she can't attend. That's why it's very important for you to also have another choice as a midwife, because usually we work in pairs or we work with apprentice midwives. So you develop a bond throughout those weeks, 40 weeks of pregnancy. Every month, you'll develop a bond, a friendship, a trust, someone you can call when you're scared or just have a simple question. And that is what differentiates a midwife from a doctor. Now, as a lay midwife, I actually was a doctor before I became a nurse. Because midwives, we are in charge of your entire pregnancy from start to finish, including all types of psychological aspects, spiritual aspects, your body, how it's changing, your mind, anything that's concerning you or that you're happy about, your nutrition. And that is because I want to start off by giving you the very, very best care from the beginning. So when we get to the point when you finally do go into labor, you're going to be surrounded by what you consider a trusted, loving, professional person that will make sure that at all costs your birth will be a safe and wonderful experience at home. Now, one thing I will say about midwives is that a lot of times some of the things that come up in pregnancies, usually within the second trimester, around, I'd say 4 to the 6th or 7th month, is when things will come up that we can fix. We can fix a problem, and therefore it is not a problem by the time you have your baby. However, when you meet with a doctor, if you have a problem, you will probably continue to have that problem. You will receive a lot of testing. You'll be scared to death a lot of times. And usually you're induced, meaning the labor is forced. Now, as a midwife, we don't force labors unless there's a good reason for that we'll go into through the classes that I'll have. And with that being said, without having any knowledge of what you're doing or any questions to ask because you don't know. You'll be educated. You'll know the right questions to ask. And if anything, if it runs into a problem as a midwife, we don't just stop there. We will go together to the hospital until the birthing. So, with that being said, I am experienced in pretty much every single complication to every single wonderful thing that naturally happens with the body, and the classes will be focused in that type of fashion. So I hope I answered some questions about what a midwife is. Now, what a midwife is not is she's not a doctor, meaning I work with herbs, I work with vitamins, I work with nutrition, I work with exercise, I work with working out problems psychologically between you and your spouse as things get different. And I will not be able to write a prescription, nor will I be able to offer you pain medication when you're in labor. A lot of times, what I've seen happen as a nurse is I will work with a lady for 11 hours and she is doing fantastic and she is exhausted, but she is just about ready to have her baby. And I've been working with her for 10, 11 hours, and her doctor will walk in and say to her, I hate to see you suffer like this. You know, you don't have to do this. We can just go down to labor and delivery, and you can have an epidural, and you won't feel anything. What happens in that particular instance is that's like a carrot in front of a horse's mouth. I had one lady ask me one time, well, I want to try it naturally unless I need an epidural. And what I said to her is this: everybody needs an epidural when they're in labor. There comes a time when you're going to want an epidural. That does not mean that it's a good thing, okay? And we'll talk about that later. But when you get an epidural at the time the doctor says this and you're about 8 centimeters dilated, to me that means you're going to have a baby within the next 40 minutes. However, if you get an epidural because your doctors come in and you're in a weak point and you're thinking you're never going to get over this, you have just extended your birth till you see your baby by at least 3 hours and have about a 50% chance of getting a cesarean because you can't feel the urge to push when you become fully dilated. I've seen this happen over and over and over again, and it's very distressing, especially as a nurse or a midwife that's worked with you for 11 hours. You're great, you're a trooper, and anybody that had that carrot in front of their nose would go for it, unless you've got what I would say mind over matter, which we work through throughout the time we work together. And however, if you want an epidural and you're at home, we're going to go to the hospital and have an epidural. Because that's another thing a midwife honors. She realizes that she's helping you and your family, not the other way around. You're not paying me to have me tell you what to do like a doctor. You are going to be paying me in whatever way we figure out to support you, to be your advocate, to be smart, to prevent problems, to work together for solutions, and to be someone that you can really trust. I know a lot of midwives too that actually have been very disappointing to me. They're not as experienced as they say they are, and I find them running into problems where they will take a lady into the hospital when it's really not necessary. And then that becomes a hospital birth. And again, when you go into the hospital, you have about a 50 to 60% chance of having a cesarean section surgery, which is a whole other animal. So I hope I answered a few questions about what I can't do. Now, what I can do when you're in labor is we are going to develop a toolkit of many, many different ways to make you comfortable at all costs, safe at all costs, and happy and proud of what you're doing when you're having this baby. You're not going to be left alone. you're going to be helped. And so will your husband and your family members. Just remember, I would work for you. You don't work for me. With that being said, I hope that you have a better understanding about what a midwife does and also sees your baby for a week or two and yourself after the birth, goes by all the state laws, as well as afterwards works with breastfeeding and with looking forward to birth control. I'm really excited for all of you for being pregnant, having a baby has been some of the most incredible, most wonderful experiences that I've ever had in my entire life. And watching women and families come together at home, bonding, and having lovely, lovely births, and beautiful, bright eyed babies that have no medication in their system, breastfeed right away, is something that does my heart good. So, with that being said, if you have any questions, please put them down below. Please subscribe so you don't miss out on the series. I do have a donation button, keeping in mind that I want everyone to have this information, whether you donate or not. So, with that being said, thank you for letting me help to serve, and I hope I get to know you better. And with that, peace on earth and goodwill towards all.